Hi class, Jessica Dela Cruz. I chose to focus on the Code of Ethics. It has 9 sections. The fifth section, Section E, focuses on evaluation, assessment, and interpretation. I think that what surprised me most was my reaction to Section E8, which is multicultural issues and diversity in assessment. Liberty University, rightfully so, has always spoken out about the importance of multicultural aspects. Uh, like, for example, in one of my classes, they were saying in some cultures it's acceptable for someone to speak with dead spirits. In other cultures, if someone comes in saying they speak to dead spirits, they may be in need of a diagnosis and treatment. So it's critically important to take these factors into consideration. But Section E8 lists a host of factors, to keep in mind when selecting and using assessment techniques. They are age, color, culture, disability, ethnic group, gender, race, language preference, religion, spirituality, sexual orientation, socioeconomic status, and other relevant factors. After I read all of those, I instantly became overwhelmed. I think most people go into the field of counseling because they genuinely want to help people. I know that's the case with me. So when I read these different factors, I think it's appropriate they're in there. I'm glad they're in there. But there's so many variations in there. Like there's different cultures, different ethnicities or races, religions, and then there's different combinations of these factors that I just became overwhelmed. I want to make sure I use a technique. I was thinking specifically of tests to use when I'm in the field with his will, um, like the SASSI-4, which screens for the likelihood of having a substance use disorder, or the alcohol use inventory or severity index, excuse me. Making sure that the demographic factors are taken into consideration, but I also know there's no like one size fits all. And if I don't use an assessment measure that's appropriate for each unique client, it could have long-lasting negative ramifications because assessment and the results affect diagnosis, treatment. I guess I just became overwhelmed because I want to help. Hopefully I'm not overthinking this, or I don't know, maybe because of this exercise, I will be especially careful or mindful of these factors when it comes to assessment. Again, with his will in the future, hopefully when I become a client or a counselor. So hopefully I'm not the only one that feels that way. Anyways, Merry Christmas and have a blessed day.